Welcome everyone! Today's explainer comes from the book 140 Must-Know Meds, Demolish Nursing Pharmacology. We're going to dive deep into two essential medications that work in completely different ways in the body. We'll start with drug number 5 in the series, Albuterol, followed by number 6, Alendronate. Let's get started. Okay, here's our game plan for today. First, we'll talk about albuterol, the drug that helps patients with asthma and COPD breathe a whole lot easier. Then, we'll switch gears completely and talk about alendronate, a medication that protects the bones. And finally, we'll sum up the most important points you need to remember.
We're going to kick things off with our first drug, a fast-acting bronchodilator that most of us know, especially anyone who deals with asthma, albuterol.
Let's get right into it. We're going to break down exactly what albuterol is, why doctors prescribe it, and how it works its almost magical effect on a biological level to help people breathe better. Think of this slide as albuterol's official ID card. As you can see, its generic name is albuterol, and its trade name is Proventional. But the most important thing here is its therapeutic class, a bronchodilator. That name tells you its main function simply. It dilates the bronchial tubes in the lungs to make breathing easier.
So, what's its primary use? Picture a patient having a severe asthma attack. Their airway is so narrow they can barely breathe. This is where albuterol comes in. It's the first line of defense against airway obstruction in cases like asthma or COPD. Its job is to open up these blocked passages and get the air flowing again. It's truly a lifesaver in these situations.
And here we see its simple yet effective mechanism of action. How does it work exactly? Well, the process happens in 2 steps. First, the drug binds to specific receptors in the airway called beta-2 adrenergic receptors. Second, as soon as it binds, it sends a signal to the smooth muscles lining the airways to relax. This relaxation is what widens the airways and makes breathing so much easier.
Excellent. Knowing how a drug works is one thing, but using it safely is everything. So now let's move on to the precautions and essential nursing considerations you need to know to ensure patient safety.
The information on this slide is extremely important. Albuterol can interact with other common medications. For example, it might reduce the effectiveness of beta blockers or lower the levels of the drug digoxin. And check out the warning about overusing inhalers, because strangely, it can lead to the complete opposite of what's intended, a bronchospasm. That's why we always need to monitor for side effects like chest pain or heart palpitations. And it's not just about drug interactions. We have to be very careful with patients who have chronic diseases. For example, a patient with heart problems, diabetes, glaucoma, or even seizure disorders. With these patients, we have to use albuterol with extreme caution because it could worsen these conditions. Now, let's change course completely. We're going to move from the respiratory system to the skeletal system to talk about a drug whose job is to protect the bones, alendronate. Its mechanism of action is entirely different, but its importance is no less than albuterol's. And just as we did with the first drug, here's the ID card for alendronate. You might have heard of its trade name, Fosamax. Its therapeutic class is bone resorption inhibitor. What does that term mean? Simply put, it's a drug that prevents the breakdown or erosion of bones, which is vital for maintaining their density.
The primary goal here is to combat bone mass loss. Imagine an elderly woman whose bones have become brittle due to osteoporosis, and any simple fall could cause a serious fracture. This is where alendronate comes in, prescribed to treat and prevent this condition, whether it's caused by aging, menopause, or even long-term corticosteroid use. Its mechanism is very precise. Our bones are in a constant state of renewal thanks to 2 types of cells, bone-building cells and bone-destroying cells. What alendronate does is it targets the bone-destroying cells and stops their activity. By doing so, it halts the process of bone breakdown and preserves its density and strength.
With a drug like alendronate, how it's taken is every bit as important as its effect. The correct instructions for taking the drug are key to its effectiveness and the patient's safety. So let's focus now on these critical instructions.
These 3 steps you see on the slide are absolutely non-negotiable. First, it must be taken first thing in the morning on a completely empty stomach. Second, with a full glass of water, and I mean only water, no juice or coffee. Third, and this is a very important point, the patient must remain in an upright position, sitting or standing, for at least 30 minutes after taking the drug, and they can't eat or drink anything else during this time. Why all the complications? To ensure the drug is absorbed properly, and to avoid the risk of irritating the esophagus. In addition to these strict usage rules, we have to remember to monitor lab tests.
Since the drug affects the bones, it's absolutely essential to assess calcium and vitamin D levels in the blood. And we need to be mindful of any patient complaints about a potential side effect, which is muscle pain.
So we've covered 2 completely different drugs that work on different systems in the body, and each has its own set of rules. Now, let's put them side by side to summarize the most important points you should take away from today's session.
And this slide wonderfully illustrates the fundamental difference between them. Albuterol is for the respiratory system, and alendronate is for the skeletal system. Albuterol is fast-acting. It relaxes smooth muscles and opens up the lungs. Alendronate, on the other hand, works over the long term to inhibit bone-destroying cells and maintain density. 2 different goals and 2 completely different mechanisms.
And to conclude our session, I want to leave you with this question to think about. How can mastering these fine details transform you from just a student into a safe and professional practitioner? Always remember, understanding these details, from the mechanism of action to precautions to precise usage instructions, it's not just about passing a test. It's the foundation of critical thinking that turns you into a safe, effective, and confident healthcare professional capable of ensuring the safety and well-being of every single patient.